So today's question comes from Mirko, and he was asking me my professional opinion about coconut oil pulling. So the past few years this has been quite a hot topic, and I am fielding a lot of questions from my patients. I have probably 5 patients that I can think of right offhand. Actually 4. One just stopped using it. We're doing a little trial for her to see if how things go without using it. Anyway, coconut oil pulling. So it dates back about 3,000 years in India. It was part of an Ayurvedic medicine practice, which had to do with the mind, body, spirit balance. And so this is nothing new. It just made a resurgence as of recent years. So with the coconut oil pulling, what you would do is you take about, I've read anywhere from half a teaspoon to 2 teaspoons. I use 1 teaspoon of coconut oil. What you do is first thing in the morning you get up, teaspoon of coconut oil, and you roll it around gently in your mouth for 10 to 20 minutes. Now about the 15-minute mark, I think, is when bacteria start to die. And of course the only study that I've seen had to do with a yeast in your mouth, and the only bacteria that specifically that I've seen any decent studies on had to do with strep mutans. Now strep mutans is known for causing cavities, so of course it's a target. People like to destroy that one. So that study did show a reduction in strep mutans, which is good. My concern would be that it's not just strep mutans that would die off. I would think that all bacteria would suffocate or be destroyed. See, what happens is when the oil breaks down, this lipid, it's a fat, when it breaks down, there's some acids that are formed by the enzymes in your spit trying to, it's the first part of digestion. So basically the fat's being broken down turns into an acid, and then that's what kills some germs. So it's good to have an antibacterial property. My concern would be there are thousands and thousands of germs in your mouth, some that are just kind of latent, they're really not causing any harm, and some that are actually disease causing. They're all competing for space. And so if you believe in that Ayurveda, which is the balance, this balance between the mind, body, and spirit, I also believe that there's a balance in your gut, a balance with your food, a balance with your own digestive system and your own body's capabilities of fighting off infections. So I don't know that I want to use any antibacterial that kills all germs in your mouth indiscriminately, if that makes sense. Like Listerine, I think it's kind of overrated. If you have no infection in your mouth, there's no disease process, I don't see the benefit of killing all the germs in your mouth. Anyway, so I'm not a good test guinea pig for the claim that coconut oil will whiten your teeth. I can see how it would, because if you have fewer germs in your mouth and not so much of a slime layer on the surface, and if you're paying attention more to cleaning your teeth, brushing and flossing and using the coconut oil, I would think that over time any of the surface stains would loosen up a little bit and brush off easily. This being a fatty substance, I could see how it would kind of like moisturize this light layer of tartar that's on the surface of your teeth and would brush your way easily. There's a lot of testimonials from people. Now granted, it was all on the internet. I haven't heard anybody in my life say that yes, definitely their teeth are whiter, that they saw a big difference. But anyway, the testimonials are out there. So there are a lot of health benefits to coconut oil, skin and hair improvements. There have been claims that it helps with digestion, that it helps with jaw pain and headaches, but keeping it specifically to the dental world, the one thing that I'm most concerned about is that there are a lot of entities out there that are trying to convince you that the coconut oil will reverse decay. It does not. Your teeth demineralize. They get damaged every time you eat. Every time you have anything with sugar or any kind of acid, the pH in your mouth drops and your teeth get pitted. They get etched a little bit, but then the enzymes and the minerals and the proteins in your spit actually bind to the tooth and remineralize your teeth. So this process is always happening. It's amazing. Your enamel on your teeth is like volcanic glass. It's right up there with obsidian as far as how hard it is. So your teeth are repairing themselves continually. Now, there's an outer shell of enamel that's super, super hard, but when plaque acids and food acids, like sodas and energy drinks and stuff like that, when the damage goes past that hard outer shell, the inner part of your tooth, not the nerve, but the second layer of your tooth called the dentin, it's really spongy compared to the outside of your tooth. And so if the tooth cavitates, if you get a cavity or a hole down into that second layer of your tooth, coconut oil is not going to reverse decay. It's not going to fix these things. You need to see a dentist. I'm not going to change my mind about that because it's not been proven otherwise, and I don't want people to think, oh, I'm going to save money and not go to the dentist by using this coconut oil. It's a false claim. Please, if you think you have a cavity, you need to go in and have it checked out. Also, periodontal disease. Okay, so if your gums are healthy and you don't have pockets, you don't have infection, you don't have places in your mouth that you can't physically get to with your toothbrush and floss, I have no problem with coconut oil. Kill some germs, some of it absorbs into your bloodstream and has other health benefits. It's not going to cause any damage. I am not trying to be anti-coconut oil. But when you have periodontal disease, when you have inflamed gums, when you have tartar that's stuck down below the gum line, the coconut oil does not remove that. It does not repair the bone. It doesn't regenerate bone and grow it back, and it doesn't get rid of all that infected tissue, and it cannot remove the tartar that's deeply embedded down below the gum line. So again, please don't believe the claims that it's going to reverse your periodontal disease and it's going to reverse your cavities. Other than that, see your dentist, see your hygienist, and if everything's fine, use the coconut oil as a preventive measure. I also have to be honest about the time. 10 to 20 minutes of rolling something around in my mouth. I don't have time for that. I don't. Now, I did see one study on, I think on PubMed, but anyway, there were a couple cases of a lipid pneumonia, which can possibly happen if you've got something like a coconut oil or sesame oil in your mouth for a long time. There is a chance that you can aspirate some of that and it can cause a pneumonia. So that's it. That's my opinion on coconut oil. If you guys have any questions, please leave a comment below. If you use coconut oil and you've noticed a big difference in your life, please chime in. Thanks for watching. Subscribe if you can, and I'll see you next time.